first aligners today. I will fit them for you, make sure they fit in nice and snug, and I'll teach you how to take them in and out, and then I'll leave you with Amanda to go through details instructions with you. I'll start with the lower one. And with the bottom one, it's different than the top one in that the teeth are smaller, so they're matching your smaller teeth are at the bottom, while the top one, teeth are bigger, again matching your top teeth at the top here. Start with your lower aligner. Open your mouth, please. So you just very simply insert your aligner like this. You start with the top, make your way all the way at the back, make sure it's fitting all the way nice and snugly. It should fit really easily, and you massage it with your thumb like this. Make sure the fit is good, and you do the same with your top aligner. You can fit it at the back. Make your way all the way and set it in such a way. I'm going to give you some chewies as well, right together. I'm going to bite on them to make sure that you're seating the aligner well. So that's how you insert it. It's really simple. Now to take it out, for the bottom one, you just go to the very back and flick it up. And for the very back as well, flick it up and gently pull the aligners out. With the top ones, again, you go with your index finger and try to flick it from the inside like this. And then the opposite side is exactly the same with that. And you pull it out. So again, it's simple. In. You massage again, make sure it's fitting nice and snug, and out.
Okay, so we've got your aligners today, so this is them here, okay, and as Dr. Mazar, she's tried them in and make sure they all fit fine, and now we're just going to have a little practice taking them in and out. The bigger teeth are the top ones, and the smaller teeth are the lower ones, okay, so that's the top ones there. You can have a go at popping those in, so just sort of, you'll feel, just sort of line them up and push them in, okay. Yeah, perfect. And as you did, use your fingers to press them in and just give them an extra press. Never crunch them in with your teeth, okay? Yeah. So now we can do the lower ones as well.
Cool. Yeah, will you let me know what I'm going to say?
Perfect, yeah. So same thing for this, using the fingers to press them in, and that's perfect. You're going to need to use something called a little chewy. Okay, so with these ones, you're just going to open and then you're going to squeeze onto each one, because we want to make sure now that they're all nicely seated, okay, so you don't want to leave any sort of almost daylight showing through, okay, so if you open, you're going to pop it in there and then just squeeze, and then open, and then move it around, squeeze, and then open, move it around, squeeze, okay, so you can have a go doing that one, just make sure you're comfortable with that. Perfect. Excellent. So every time when you're popping them in, just make sure that you just have one of the chewies with you, and you can do this, okay, every time that you're seating them. And then taking them out, if you want, just, most people, they just use their fingers, so I would use your index finger and then go to the inside and then just sort of pinch and pull it down. You should find a little ledge, something like this, that you can find comfortably to pull. Yeah, once you've got one side, then use the opposite hand to get the other side down. Once you've loosened at the back, like you're doing, just gently pull, and then that's fine, exactly, perfect. Excellent, and then with the lower ones, you can use your thumbs, okay, and same sort of technique, you can just find a little ledge, and then just give it a pull up. Perfect, well done. I'll just give you a tissue. Yeah, sometimes you can produce a little bit of saliva, and this is just normal, it's just while everything's getting used to, all your mouth and everything is getting used to it, okay, you might just produce a little bit more saliva at first, but then that will stop. With this type of aligners, you need to be wearing them for them to work. So 22 hours a day for these aligners. Those 2 hours we sort of say is when you're eating or when you're cleaning your teeth. That's that sort of 2 hour leeway, but other than that they need to be in constantly for you to get the full effect from them. So looking after them, you can only have cold still water with them in, so every time that you want to have something to eat or drink, you're going to need to take them out. Okay, so that means all hot drinks, anything like that, always make sure now that we're taking them out. Okay, so just cold still water. Always try and make sure that you have clean teeth when you're popping them in, so either you can use your brush or just use some mouthwash if you want, if you're out and about and it's not convenient to always brush the teeth every time. Anytime they're not in your mouth, you pop them straight into the box, even if it's only for a few minutes while you're doing your teeth or something like this. It's just safer to get in that routine if you put them straight in the box. Never wrap them in a tissue, because tissues just get thrown in the bin, okay? Same with don't put it in your pocket, because again you might forget about it, put it in the wash or something like this. These aligners, they're heat sensitive, so you want to make sure that they're always staying cold basically, so don't leave them sitting on the windowsill with the sun shining on them or near a radiator with the heat, because that might distort them a little bit, okay? And again, when you're washing them, you just use cold water and no hot water at all. Don't use toothpaste to clean them because that just scratches them. Just use some, cold water and just your brush and gently brush any bits that are sort of there to disinfect them. You can get yourself something called Retainer Bright, which is just this one. Okay, and it's just a little tablet. You just pop it in a glass and it all fizz up, and then you can just soak the aligners in there, okay? And that will just keep them nice and fresh and disinfected. Okay, so you should get some little cleaning tablets in the little pack that you get as well. So that will all be in there, and you'll have a little case in there as well, and all the instructions should be in there as well. If you have any problems with them, something's just not feeling right or anything, you can always give us a call and then we can advise you on what you need to do. Okay?
Okay, thank you very much.
Perfect, you're welcome.
I can't believe I chip old so much. Wasn't it?